Welcome everyone, and thank you for watching this video. I'm Dr. Fletcher M. Piri, and I'm very passionate in supporting online and distance learning adults to achieve their education and professional dreams. In this video, I want to talk about how online and distance learning adult students can use Writing Nursing Assignments book. Its ISBN number is 9781800946583, and it is available on Amazon in both hard and soft copy formats. And you can access the book using this Amazon link. This book covers the assignments for access to nursing, nursing associates, level 4 assignments, level 5, level 6, and level 7 nursing assignments. It also covers how to write in-text citation and reference list. In this video, I've taken one assignment from level 6, which is Bob and Ethical Dilemma, and this is level 6 nursing and midwifery case study assignment. The actual title of the book is Using Previous Students' Feedbacks to Enhance Distance and Online Adult Learning Students' Success in Writing Nursing Assignments. This case study is about Bob, and this case states Bob has attended the genital urinary clinic at his local trust hospital. Bob is seen by Dr. Gomez, who informs him that he is HIV positive. Dr. Gomez counsels Bob to contact his sexual partners to inform them of his status. And then Bob starts a course of treatment. For the last 18 months, Bob has been in a relationship with Sue. They are expecting a baby in 2 months' time. Before this relationship, Bob had a series of sexual partners. On a subsequent visit to the clinic, it becomes clear to Dr. Gomez that Bob has not told Sue of his HIV status. Dr. Gomez is aware of the impending arrival of their baby and tells Bob that steps should be taken to assess whether Sue is HIV positive and whether the baby is at risk, so that if necessary, treatment may be started. But Bob adamantly refuses to tell Sue and says that if he is going to do that without his consent, then he will stop taking medication. So what should actually Dr. Gomez do? Now, in this assignment, you have been told what you are required to do. So you are required to write an essay of not more than 3,000 words, critically discussing the application of ethical theories or approaches to the ethical dilemma in your chosen Bob case study. Let's stop a bit for a moment on this slide. There are a number of things here which are very important. The first one is that you are requested to write an essay, not a report. Therefore, you need to write an essay. In order to do that, you need to know the difference between an essay and a report. So do not write a report because you will lose the marks. The second important point is that you are required to write 3,000 words. Now, check that your university does not allow 10 plus minus 10% of the total words that you have been given. So, for example, in this one, you can actually write, if you are allowed to write, to write more than 10%, should have been 3,300, or can be less than that, which can be 2,700. But if you are not allowed that, then you have to write 3,000 words, otherwise you lose marks. The third point is that in your writing, you need to be critically discussing, which shows typical this is a level 6 assignment. Level 6 writing does not need to be descriptive. If you write it descriptive, you are more likely to get low marks or even to fail. So you need to know what does it mean to be critically discussing something. And the fourthly is asking you to apply the ethical theories or approaches. Again, do not write theories, but apply theories to this case you have been given. If you write theories, then you are more likely to fail. And it's not the way level 5, level 6, level 7, and level 8 nesting assignments are supposed to be written. So make sure you take into account all these. There are further guidance that have been given in this assignment. So the first says you need to describe the case study containing an ethical dilemma. This should be no more than 200 words, and make sure your dilemmas are realistic. Not only being realistic, but they must actually be relevant because you need to show that you have analyzed the case, you have read and analyzed the case, and pick the relevant things that are important. It says that you need to identify ethical issues the dilemma raises. There will be more than one, so definitely there are going to be more than one because we have more than one client or more than one person we need to deal with. Identify the different people involved, describe how each one might view the dilemma, and explain why they take this position. They have given you examples. Different people might include patients, users, carers, family members, the public, pressure groups, frontline professional workers, health and social care assistants, youth workers, service managers. Again, you are not going to use all of these. They have been given as examples. So you need to pick those that are relevant to your assignment. Do not write everything that have been put here. Then it means you are not understanding your assignment, but also you are not applying to your assignment because your assignment is going to have a specific group of people that are involved. Further guidance, identify and discuss the potential conflicts and points of agreement in terms of ethical arguments. Consider how gender, ethnicity, religion, age, sexuality, and others might influence how people respond to the ethical dilemma. Consider how far relevant code of professional conduct and law as applied to the dilemma help with arriving at a moral solution. Remember, whatever solution you suggest must be supported by theory, but also supported by your professional code of conduct. This is very important, particularly where you have got to make decisions where you are not actually your own cultural background or your religious belief might be probably be against what you wanted to say. So, for example, we know we are dealing with the sexual and protected sexual relations here, which they are very important. And these sexual issues, sometimes they are also conflicting with our religious beliefs. For example, a family using condoms might not be seen as acceptable in a Christian setting. But in that situation, if you are a Christian, then you need to take into account your Christian values, but that should not affect your work. So that's where your professional judgment comes in. Your professional code of conduct, you need to inform you how you're going to make the decision. Right, so we have read the case, we know what a case is. And then now, how do we actually tackle this particular case? So how do we tackle it? The first, we need to analyze it, or we can summarize what are important issues in the case study before we start writing our essay. Right, so here is the summary. So the very first analysis. Now, this is not saying that's the only way you can summarize it. You might actually summarize it in your own way. But here we need to identify the most important issues. So based on my analysis, these are the most important issues we need obviously to focus on when we are writing an essay. We should do this before we start writing our essay. Now, the first point is that the patient has been tested HIV positive, and the doctor has informed him and has cancelled and started on the treatment. This is very, very important because obviously there are certain changes that he needs to make in his own life, but also changes that need to be made to the people he actually was engaged in a sexual unprotected sexual intercourse with them. And then the patient has a history of previous multiple sexual partners, which obviously increased his risk of contracting HIV. But also, it is going to be these people who have had sexual intercourse with him, they are more likely, if they are positive, to be spreading the virus to the society as a whole, to the community as a whole. So therefore, we need to think of them as well. Then his current girlfriend, wife, depending on what you call it, you're not going to use all of these. Probably in this case, it's more likely to be a girlfriend, or because they tend to call them partners, depending on where you are. So it might call a partner, might call a wife if they have properly married, or it's just a girlfriend. Now is expecting a baby. Yes, so that's very important. So important because if he's having a baby, we want to make sure that the baby is going to be protected. Doctor advises the patient to inform his sexual partners. These are partners outside the girlfriend, current girlfriend he has. As he said, they're including his current pregnant girlfriend. Now, patient is not keen to take this doctor's advice and threatens that if a doctor does so without the consent, would stop taking medication. So we have a problem here. Should we actually disclose his positive status to the current girlfriend for the sake of taking action to prevent the spread of HIV to unborn baby, or should we actually um, uh, accept what the patient is saying, so that he may not stop taking medication, he should continue taking medication? Because if he stops taking medication, then we are actually attracting resistance, which might not be a good thing. But also, if we do allow him to not to form his partner or his girlfriend, then if the girlfriend is HIV positive and we don't know, then he's not going to take a antiretroviral, because if he's positive, we know he's positive, which means we can only know if he's tested. Then we can actually take action, because we can put him on ARVs, which are going to lower the viral load, and then reduces the chances of passing the virus to the unborn baby. So you can see already, by isolating these important issues from the case study as a whole, we can see already some of the dilemmas actually we are going to have. Okay. Right. Okay. So the first, we need to identify people involved. So there's a patient who is Bob, and there's a current and previous patient sexual partners. The current sexual partner is the one who is pregnant, and the previous sexual partners are those he had engaged with in the sexual unprotected sexual intercourse with them. We have already been told he had quite a number of multiple sexual partners, which increased his risk of contracting HIV. And it might also explain why he is HIV positive. Then we have an unborn baby, which we need to take into account, because we're going to have this baby in 2 months' time. And this baby, if the mother is positive, then it can pass the virus to the baby. But also, if the mother is positive and then it starts taking ARV, the viral load will be lowered, and then once the viral load is low, it increases the chances of not passing the HIV to the baby. So the baby might be born free of HIV infection. There's the public generally, obviously, yes, because the previous sexual partners, we don't know how many they were. They are still in this community. If they don't know they are HIV positive, they will continue having sexual and protected sexual intercourse with the other members of the community. So therefore, the virus will continue being spreading. So again, how do we actually get messages? How do we get these sexual partners informed? At this point, it's only Bob who knows them, not no one else. But also, there's a danger that if Bob tells them that he is HIV positive, then and then they go to the hospital and get tested and they're HIV positive, they might be more likely sue Bob. So should we just stay quiet? Should we just leave it like that? And then we cannot control the spread of HIV to the community. Then there's a doctor himself, who is Dr. Gomez, who is actually now in a dilemma because the Bob is not accepting that he should actually tell the current partner his HIV status in order for the current partner to take initiative to get tested. And if he's positive, then he can be put on treatment so that the viral load comes lower and reduces the chances of passing the virus to the unborn baby. But also will help the current partner to take precautions so that he prevents accepting having unprotected sex so it doesn't get reinfected. Now, if the current partner is not told, then obviously um, is going to continue uh, engaging in unprotected sex, so increasing her chances of contracting HIV as well. And if he is told without the consent of Bob, then Bob might actually sue Dr. Gomez, or the trust that he had between Bob and Dr. Gomez will actually finish. So you can see already the dilemmas that we have in this particular case study. So let's continue looking at each of these dilemmas, as I've said. So the risks and dilemma to patient. So looking at patient himself, Bob, if his HIV status is disclosed, and yeah, so he may face discrimination and stigma from his colleague and also close relatives, including his partners and those sexual partners we had before. He may be harmed in the community. Yeah, we have seen people who become uh, uh, violent against people who are HIV positive. So again, so what do we do here? Because we don't want him to be harmed. In the same way, we want the community to know so that at least they can be protected. There's a risk to his work. Yeah, so Bob might actually, depending on how his manager might actually receive the news that he's HIV positive, he may lose the job. And normally it's because of ignorance. But also his workmate, if they know, they might actually start discriminating him. There might be possible rejection of violence from his current sexual partner. So more likely he's going to feel, especially if she is going to be HIV positive, she's going to be directly knowing that it has been passed to her by Bob, and Bob is more likely to be actually rejected and may even face violence from this current sexual partner. There's also fear of court action if any of the previous sexual partners are infected, and if they know they were infected by Bob, they can actually take a court action. So you can see this is the problem. Now, should we not disclose? If we does not disclose, what will happen? He may continue having unprotected sex, so therefore continue spreading the virus to the population as well as community as a whole. Yeah, so that's the first dilemma related to the patient. Should we disclose? Should we not disclose it? What about unborn baby and the mother? What is the dilemma here? What is the risk? So if it is disclosed, the mother will be tested, which is good news. Now, if it's positive, we'll put on ARV, which will lower the viral load, reducing the risk of passing HIV to the unborn baby. If tested both positive and negative, a mother will take precautions by engaging in protected sex with her sexual partner. Okay, now if he doesn't disclose, then the mother will not be tested for HIV to check, so therefore we will not know. Now, mother will not take any precautions, which means no unprotected test sex, which will increase the chances also of passing the virus to the baby. The unborn baby may be infected. So you can see, this again is a dilemma. So what should we do? Should we disclose it to the mother or should we not disclose it? What about the dilemma to the community and population? What are the risks? If the previous sexual partners are not informed, they will continue having unprotected sex in the community and continue unknowingly spreading the virus to the community. So that's not a good thing. Now, if they are informed, they will go for HIV testing and be cancelled, hence stop having unprotected sex depending on their HIV status. About to the doctor, what is the dilemma or what is the risk? If he discloses patient's HIV status without consent, then the following might happen. So patient trust will be lost. So Bob will never trust Dr. Gomez anymore. Patient's confidentiality will be breached, yeah, because obviously there's no consent there. So that confidentiality will be breached, which is not going to be a good thing. Patient will stop taking medication, which means risking developing resistance, because he has already said if his HIV status is going to be disclosed without his consent, he's more likely to stop taking medication. There's a risk of legal action against the doctor. So if he discloses without his consent, and then obviously Bob will kind of take legal action against Dr. Gomez. He may actually also engage in physical violence, which means he can end up engaging in physical violence against Dr. Gomez. So you can see the dilemma which is here. Now, if he does not disclose, we know patient current partner risk being infected because obviously he's going to engage in unprotected sex. Then also unborn baby may be infected, and HIV may continue being spread in the population or community through previous untested sexual partners. Right. Okay. So this is the level 6 assignment, which obviously it was a case study, and you needed to conduct a summary and a case study analysis before you write your own essay. Now, obviously, each of these dilemmas should be each paragraph. That's how essay is different from report. Report would have been having headings. So these headings are put, they're just helping you to structure your assignment into paragraphs. So each one of them should be paragraphs. I'm sure you can see once you analyze them this way, it's easier for you to address. There are a number of dilemmas, but what Dr. Gomez should do at the end of the day, he need to engage in a professional code of conduct. So what does his professional code of conduct say? Because that's what is going to support him, and also what do the theories say. So each of the decision that he makes is going to make informed decision guided by his professional code of conduct. Remember that all these they are part of ethical dilemmas that are going to be made at each of the stage that you are actually trying to make a decision. I hope this helps. As I say, you can find assignments for other levels. So for the access to nursing, for nursing associate, for level 4, level 5, level 6, and level 7. Level 7 is a master's level, and level 8 is a doctorate. So what is missing here? They are level 8 assignments, but otherwise you have samples of different levels of nursing levels assignments, which obviously you can learn from. So There are mistakes that are made by students, and then they have been corrected, so that you are shown how to correct them. And this is very useful. So in a sense, you are learning from previous students' mistakes, and that's the main purpose of this book, is to help you where to start from, which is most of the time students ask me, where do I start? Where are the samples of work that I can see from previous students? And this book obviously has compiled those. So do not copy them, because they are real previous students' assignments. You'll be caught with plagiarism, but learn from them. Try to understand what you want to learn or what you are required to do. So I hope this helps, and all the best. Thank you very much. Bye for now.